It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Hello, everyone, and I want to thank you from the bottom of my heart for tuning in today to another saga episode of New Wellness TV with Dr. Lee. We're going to have a surprise for you in 2018, but for right now, I have two wonderful guests here with me, and I am so excited. And what I really enjoy is that I called these two people at the last minute, and they made it happen, not knowing that coming together was so much synergy as it's all coming together. So I am excited, I'm thrilled, and I'm happy to have my first guest is Dr. Lucy Rojo.
Good morning.
Good morning. We almost wore the same clothes today because I pulled my jacket out and looked like that and I was going to wear it.
Brilliant minds think alike.
Yes, indeed. I just want to thank you again for being here.
You're welcome.
We have a wonderful topic that you're going to be sharing with everyone, and my second guest is just an amazing person. I want to introduce him, but we will be coming back with him. So everybody don't leave now. Hold on to your seats. But most important, get out a pen and paper because I'm sure we're going to have information for you that's going to help you at the end of this year, but for the rest of your life. So, but my guest is K.B. Solomon. Now, you recognize that voice. That's the voice that's my intro for my TV/radio show. I want to thank you, K.B. Solomon, because you are an amazing, amazing light on this planet, this amazing God sent.
Well, thank
and
you.
I thank you.
It's a privilege to be here with you.
Thank you
as
so
we
much.
contribute to this human experience.
Yes, we are.
Yes.
Thank you.
Yeah.
So we're not going to get into a lot of talking right now. I'm going to interview my wonderful guests. But first of all, I want to, we have a really great title for this show today. And I want you to share with my guest our topic today.
Well, this morning we will be speaking about prevention in multiple areas of people's lives.
Exactly. Mm-hmm.
And it's an exciting topic because it's often less expensive to deal with prevention than reactive
Exactly. And that's why I have a nonprofit myself to deal with prevention on many, many levels, which I'm really excited. And we're going to be joining some forces as it relates to healthcare because you are a natural, an ND, naturopath doctor. And we'll get a little bit more into who you are in just a second here. But just an amazing, we met through a very mutual friend.
We did.
Yes, and she's just a wonderful person. So I'm not going to say her name because I know she's going to see this show too later, but she's wonderful. So I want to let's just start off. We're going to talk about prevention as it relates to the kind of the four pillars that you kind of have there on the spirit, the mind, the soul, prosperity, and so forth and so on. Because there's so much under there. And if we don't get those aligned, with our spirit, our body, mind, soul, we're not going to be prosperous if you don't have those things in line. So it's very important. So let's start off by you telling people as to who you are.
Thank you very much.
Thank you.
I am a naturopathic doctor, and our credentials are ND. And we have a very similar training as our MD colleagues from the first 2 years of our training, basic sciences. And then the last 2 years are more focused on wellness approaches such as herbs, nutrition, homeopathy. Some of us focus on acupuncture. Others specialize or at least refocus on intravenous nutritional therapy. And then once you graduate, we have our board exams. We're licensed with the state of California.
Exactly.
With an accredited medical school. And then I did a 1-year residency in family medicine. So we basically are trained to see everyone from babies all the way up to our elders.
Wonderful. It is funny how our lives sort of correlates here because we do IV, and then I'm a graduate too from Drew Medical School.
Drew, yes.
As a physician assistant, and my ND and then P.H.D. So just love, it's so fascinating that every component of helping a person to heal is not just isolating And in my traditional training on the allopathic side, you don't get that. You don't get
No.
that. They walk in with a so-called disease, and you work on that disease or that symptom that they walked in the door. You don't work with the whole person. So this is amazing. This is great because NDs work also with the whole person. So this is why I went back to school after my training, because I said, it seemed like something that's left out here.
Exactly.
So pulling it all together, the body, mind, soul, spirit, the emotional component is so important, because that's really where diseases start, with that
Yes.
emotion, what we don't let go of, what we don't clean up, and what we don't detox from here.
Exactly.
Yes, which I have an audiobook, meditation on detox the mind and the body will heal, which I know KB is going to be working with me to do a little, spice it up a little bit more. But I'm just so thrilled to have you here. Now, what made you decide to go to school? I mean, usually we all have a journey as to why we became, who we are in the medical profession. So what was your journey?
Well, when I first started, my plan was to go to medical school, traditional or conventional medical school.
Okay.
I was in the military, so my expectation was military would help me pay for that.
Okay.
But, things happen, and God leads you down a different path. And conventional medicine wasn't the path that was open to me at the time. My second love was teaching, so I went into teaching for a couple of years and realized, I really love medicine.
What were you teaching?
I actually taught in West LA. I was teaching biology and health to 7th and 8th graders.
Oh, my goodness.
And it was quite the
Okay.
journey.
Oh, I'm sure.
A very quick exit
Yeah,
out of
this-
that. And
yeah, 'cause
I said,
these teenagers today are not the same.
no, they're not.
Yes.
No, they're not. And it really stretched me and grew me in a lot of ways. And what it helped me realize, Dr. Lee, was I love teaching, but that wasn't the group that I needed to be teaching
Right,
to.
exactly.
So this is the adults and people who are really interested in being preventive about their health and proactive about their financial life. All of those things are exciting to me. I
Yes.
love teaching. I love public speaking. But that was just not the group for me. So when I got out of that, I was at a little bit of a loss for where do I go? What do I do now? Because I thought it was medicine. I thought it was teaching. Military, it all seemed to fall apart. But the nice thing about falling apart is there's usually a new layer of something
Oh, yes.
beneath that. So
Isn't that a blessing?
absolutely.
Yes.
So naturopathic medical school became an option for me at the time. And I went to Portland, and that's where our naturopathic medical school is. It's one of the oldest schools since the 1950s.
Yes.
And all I knew at the time was I wanted to come out with the title doctor. And it wasn't a Ph.D.
And you
time.
did.
Yes,
You
I did.
You
I
did.
did.
Which was absolutely wonderful. So, and from there, you...
Went into practice. I had an opportunity to open a practice with a colleague, and she ended up getting a residency in Oklahoma in cancer treatment centers of America. She went off and did that. Was very successful in Washington, the state of Washington. So I suddenly again left with a practice that I needed to develop on my own, which wasn't the understanding that we had at the time. But it worked out because it stretched me yet again, and we were able to get that going. So I've been in practice for about 14 years now.
14. Amazing. How wonderful.
It's been a good journey.
Oh, I know. Because I can almost gauge my journeys through my children. Because I finished my RN training when I was having my first daughter, which is 41 years old. Then I went back to school, so I can almost gauge. So it's been 30 plus years.
Wow.
Yeah.
I could tell you're a lover of education and,
Oh, yes.
and knowledge seeker.
Oh, yes.
Same
Especially
here.
with all of the additional training and workshops and anti-aging and AFRM and dealing with all that stuff and other workshops and seminars. Because it's a vast world of what's happening right now when it comes to healthcare and things that are new that are constantly evolving.
Yes.
And if you're just stuck in a box, you won't grow, and you won't help your patients to grow. And my prayer is to always be able to obtain the knowledge and understanding. But sometimes I just say, you know what, I cannot be everywhere. I have a girlfriend that said, you can't do it all. So I said, God, just download the information while I sleep.
Exactly.
Just download the information. And then it's funny how I wake up and I end up going to a site or something and say, oh, okay, okay, this is what I want to, get a little bit more involved with.
Absolutely.
Yeah.
Do you find also that your patients help direct your educational pathways?
Most definitely.
Yes.
Most definitely. Because you get a patient with something that is just so odd that it's like, you know what, I'm going to be the one. We're going to solve this.
Right.
And to really, because one thing I do in my practice is put God first. So we pray first.
Absolutely.
And that was my problem trying to work hospitals, because most definitely, especially when I work for the federal prison, they're not having that,
No.
Yeah.
And we often have a similar process of seeing patients. I have a therapist friend who says he never walks into a patient visit without God, and that
Yes.
there's a team there already right from the
Yes.
get-go, before the patient even gets there.
That's what I do
Yeah.
when I leave my house. I don't have my button on today, but most people know it. It's just something that I do every day. And just, my prayer is every person that I come in contact with, whether it be a patient or meeting you that day that was so wonderful, that there's something in the soul and the spirit of everyone,
Absolutely.
and just to see what the greatness of helping to pull that out,
Right.
because disease, illness, quote unquote disease, a lot of times people are just so suppressed and stuck on many levels too. So let's go on with you.
Okay.
Okay. Now, on prevention, what do you do as far as prevention?
Well, what we do typically is we start by testing, not guessing. Oftentimes we'll have patients that are either at one end of the spectrum, where they're either frustrated and have lost their faith in conventional medicine, and they come after they've been through the battlefield, or you have that segment of patient or client that truly believes that wellness is an activity that they need to be an active participant in, and they are seeking the health professionals that will help support that journey for them. And those are often the two types of peoples, and there's gradations in between. But certainly for prevention, we get a very thorough history. The beauty of what we do is that we have the luxury of spending quality time getting a
Exactly.
thorough history,
Exactly.
as well as having the licensure to order tests that are both within conventional medicine realm as well as outside of the box. So we get a lot of good information. I kind of liken it to a puzzle, and that we're getting pieces of those puzzles. And sometimes the puzzles are all available at the get-go. Sometimes you got to take some layers off like an onion
Oh,
until you get to the
you
next.
and I say so much of the same thing, because
We keep on stealing
You
from
know.
other people, don't we?
that's the first thing I've been saying almost 30 years.
Right.
Healing is like peeling an onion. So you go through the layers after layers after layers. And, I was a patient a lot myself growing up. And the one thing that I didn't like is that people were not listening. And so that's why I became a very thorough and very good listener, because I would say something, just throw them out there just to see if the person was listening. And it would be the physician taking the report. And I'm like, really? You're just not going to even question me on that?
Right.
I just made something up. And it
Oh.
was really bizarre. And it's just amazing how they don't listen. It's like, let me hurry up and get to the next person. And then in working in conventional medicine as a practitioner, we were given, especially for HMOs, we were given 20 minutes for a new patient,
Right.
10 minutes for a follow-up. Tell me, how in the world are you going to get a thorough history, order your lab work, do all the diagnostic testing in 20 minutes?
Oh, and don't forget, write the prescription.
Oh, yeah. Yeah, that's one reason why I said this is not for me. I'm
Right,
not putting
right.
people on these medicines and shots and vaccinations. I'm just, not going to do that. So I said, this is not for me. It's time for me to exit.
Yeah. And to their defense, however, the history of how this form of medicine was developed was battlefield medicine. You had to be quick on your feet, decisive,
goodness.
et cetera, as you well know. But my colleagues in the medical side are kind of stuck between a hard rock and a hard place because of the insurance control over that situation and how much time they realistically can spend. On average, I've heard it's about 7 minutes, quite frankly.
Oh, it's 7 now?
On average.
Oh, see, that was 20 years ago I was
Oh,
there.
boy.
So, yeah, it was 20 and then it was about 10. So that's really sad. Well, I can tell by the history from the patients that I see. You know, and some very disturbing things have come out of some of the histories
Oh, yes.
that are happening throughout the world here. And then I'm an advocate for so many things. I'm an ambassador for world peace through the Women's Federation for World Peace. So I actually, you know, looking at things. I used to be the health chairperson for the NAACP. So I really dove into some things that were not correct happening to people. You know, it wasn't just African American, it was people. You know, I probably shouldn't bring this up, but I am at this point because something that happened yesterday, and the family wellness program. When I went to work at a friend of mine's clinic, she asked me if I could come and help and do the pelvic exams and pap smears and stuff. And I kept telling her, I said, you know, it's in my gut feeling, this is many, many years ago, that this is a sterilization program. And I kept telling her, there's something wrong with this program. And so I was able to, you know, I said, I'm not going to put all these young kids on all these birth control pills and do this and do that. This is just not something I want to do. And she said, well, look, we'll pay you whatever you want to come and help because people like you and the kids, young people love you. And, you know, I said, I just can't do it. So I was there for maybe a couple of weeks. But then someone else called me about 10 or 12 years later in the same area of the city to do the exams. And these people were sterile.
Wow.
You know, some of them said, I didn't want to have kids then. You know, my husband and I, we want to have children now. And this is people of color. It was brown people. It was just horrible. And to do their exam, their organs didn't even look internally nice pink color. You know, it was a mess. But the sad thing about it, this was designed by somebody who was involved with, you know, really depopulating. And I'm not going to mention any names, but it had to do with depopulation. So it had to do with someone who was running for office, who patterned it from a person who years ago was destroying the babies of women of color. And I had a patient yesterday. I didn't even know it was still happening. And in Orange County, I'm going to say the city, but in Orange County, that's what they're doing. They're telling the young girls who are pregnant, you shouldn't have this baby. They're really talking to them to abort.
You know, that is an interesting conversation that we could take a whole hour on.
I know.
Here you're talking out of both sides of the mouth, where Orange County typically is very conservative, anti-abortion, very pro-Christian. And if you have that type of activity, it seems very...
But it's a family planning clinic.
Yeah.
And the sad thing about it, they told this young lady that her 3D fetal ultrasound, the baby was deformed. The baby has a cleft palate with the mouth, and she should abort because she was young. You know, and she said, I don't want to abort. I think it's a sin to do that. I don't want to do that.
Sure.
She had this child. Nothing wrong.
Wow.
But she said in her mind during the whole pregnancy, she thought she was going to give birth to something that looked like a creature from what they described. Which was horrible.
Yep.
Listen to her story yesterday. It was so, I couldn't believe it. But I couldn't believe it because there isn't anything I have not probably heard or seen.
Well, you know, after I read the book called The Nazi Doctors, nothing is beyond the scope of humanity.
Oh, my goodness.
In terms of what medical profession can do, which is unfortunate.
Yeah, it is. And a lot of people are not realizing that you're really guinea pigs out here for a lot of stuff. I don't know what's happening with the medication because I know you're into natural health, but people come to me and they bring me their meds, and I'm thinking, you know, and even in the PDR, the physician desk reference, this pill does not look like this. So the generic medication has taken on a whole new level of being generic. I don't know what this stuff is, and I can guess where it's coming from. And it's all about...
There is certainly the bottom line about the financial aspect of medicine. But, you know, I think when there's adversity like this and there's horrific stories, it can either put you under or it can make you step up and say, how can I educate myself to be preventive about these things happening to me?
And this is what I do?
Exactly.
This is what I do for my patients. This lady now is going to write a book.
Wonderful.
I'm going to make sure she's on a couple of talk shows to discuss this because I told her, and I said, I see this. It's going to help so many other young women like yourself to know what happened, because a lot of people don't even know why this is happening to me.
Right.
You know, unfortunately, a dear friend of mine from out of state, her daughter did abort. No, but it's just a lot going on. So when you know better, you do better.
Exactly.
And each one should help teach one. That's what we have to do.
Right.
You know.
Yeah, it's not too far. Even the Tuskegee situation, airmen, you know, they're government hands.
Oh,
you
yeah.
know?
Yeah.
And the abuses that go on. So people really have to be attentive, ask a lot of questions,
They have
and
to.
be proactive about their health care.
I know this is one last one, and I'm not going to go off on this because of natural medicine, and this is why you do what you do, and this is why I do what I do. But I had a patient who came in, and he was in chronic pain, just chronic, about 70 years old, worked for the government. He volunteered when he was a teenager to go into the military. But when he volunteered, he didn't know it was a volunteer test to see how much radiation the body could withstand before the flesh fell off.
Oh, my. Your and my tax dollars are going toward that.
Yeah, yeah.
It's amazing.
And it's like
Amazing.
no money to even help him to heal from this.
Yeah.
And I just jumped in and wanted to help him. He said, "You can't help me. There aren't any records now." You know, I know a lot of people are listening to the show, but you know what? I have said this to many people, but it's just so sad. But let's get back on the track of why you do the prevention. And this is why we're so dedicated in what we do, and the history, the lab work,
Right.
all your diagnostic tests that are needed. Those things are so important. They're so important to get to the bottom of what's going on, because you're not going to hardly find that in allopathic medicine, because we're going to take time. So it's not the quantity of people we see, like
Really?
yourself, it's the quality of care.
Absolutely.
And that's what we don't have, is quality care. We don't have quality care.
I think you're right. As you know, the system is broken, and people are coming to us, I believe, because of that. They're seeing shrinking dollars in their insurance allowances, and they're having to pay more for less. And their poor doctors are having to see more people
Yeah,
for less income.
right.
So it's a situation that needs some remedies.
Oh, it does. So why don't you give me a case study? I love case studies.
Oh,
Okay.
oh. Well, I can share a story of a girlfriend of mine. She became a business associate, and she's a 2-time breast cancer survivor. And when she had her first bout, she was living south of us here, and she was looking for alternative care for cancer. I mean, she did go down the conventional route with chemotherapy, et cetera, and surgery and reconstruction. But she was looking for alternative options to help support her through that process. And she and her daughter went all through San Diego looking for services here and there. And, you know, when you're in the middle of that type of diagnosis, that's the last thing you need to be doing.
Yes.
And so she did find some services. She had to go to multiple locations, and she was able to get through that process not once but twice, you know, and she used conventional medicine as well as what we call alternative or complementary medicine to help her in between those treatments to help her have a better outcome. It is said that after 5 years, if you pass one day past 5 years with a diagnosis of cancer, you're
Yes.
in the good zone.
Exactly.
And she has been alive for several years and now is the director of the center I work out of. So we're big advocates for combined therapies and or standalone, but be preventive and be proactive, and
Yes.
lots of education. So I don't know if that falls within the realm of the type of case you were looking for, but you
Yeah.
know,
Well, you know, you have people that come to you all the time, and some of the case studies, and that's actually a great example. I do appreciate it. Thank you so much. And what's important to let people know, to hear the story, because sometimes people are kind of in the middle.
right.
She reached her 5 year and think, you know, will I reach mine? You know, a lot of prayer, a lot of healing, a lot of letting go,
Absolutely.
you know, is where we get. So when you're healing, like you said, mind, body, soul, spirit, and prosperity.
Right,
Yeah,
right.
is so important.
Absolutely.
You know.
And it just depends on where people are at, where there's the imbalance in those four corners. We like to call them the corners of life.
I like that.
Yeah, because if you have these four areas in balance, you actually do get along pretty well. You know, we equate it to a four-legged table. And in each leg, you have the mind, the body, the spirit is what we refer to, and then prosperity. If any of those four are out of balance, the whole table doesn't sit very well. Can't support what you need to support to get through life. So wherever people are at, that's where we try to meet them and support them to start that journey toward health. And it's been a really good experience. I've shifted my business model to that, and people can relate to it. Because invariably when we're talking about using alternative medicine that isn't covered by insurance, finances comes into the forefront or in the background. This may not be spoken about, but we need to address all of those. And we've got a great situation that can bring those to the forefront and help people with solutions.
That's wonderful. So you do take insurance?
I don't process insurance at all. I do offer
Okay.
patients the insurance codes
Okay.
and ask them to be proactive about what they're paying for with the insurance game, because it's their right to get that, in my opinion, but not all insurances cover alternative medicine. So
No, they don't.
We don't really have the control as to whether we take it or not. It's more like the insurance companies aren't taking us,
I know.
even
I
though
know.
we're licensed as primary care clinicians in this state.
Right. Yeah. I have never taken insurance, and I have never turned anyone away. Yeah. So I'm, with prevention, I do the stroke screening
Oh, wonderful.
under my nonprofit.
Okay.
So you and I need to talk about some things
Yes.
that, the
Yes.
nonprofit. So I'm able to go out and do carotid and vertebral, carotid artery, and I
Ultrasound.
speak on it, ultrasound, yes, bring a tech in.
Yes.
And the other component of my nonprofit is breast screening, non-radiation with a CRT machine.
Okay.
So I was blessed for the company to give me this machine under my nonprofit. So I'm actually the only one in the world that's offering thermography screening, or thermographic screening for free.
That's beautiful.
Yeah.
I should get mine done at your place.
Come right on over, and then after I do yours,
heard it here.
you can do mine.
Okay.
It's kind of hard to do yourself.
That's true. It's like giving yourself an injection,
Well, I do that one.
Oh, there you go. So do I. Got to be positioned correctly.
Oh, yes.
Yes. Well, that's
so,
great.
yeah.
I'm a firm believer in thermography. Mammography, I think, is being shoved down people's throats. There's
It has.
time and a place for all these things. But when you're doing prevention, the last thing we want to be doing is putting radiation to this already sensitive area.
Exactly, especially if there's something going on there. And the sad thing with our breasts, as you know, for women, but I also have a male spokesperson who's been on the show because he had a mastectomy when he was in his early 20s.
Yes.
And he's in his 50s now. So he is my spokesperson for the men.
That is wonderful.
Yeah,
I
so-
know an 80-year-old man right now who was originally diagnosed with breast cancer. It's kind of rare, but it's out
is.
there.
But I did a walkathon, and I was surprised in West LA. And I was surprised at the number of the men that showed up. They said they never had a platform.
Interesting.
So I will be doing this again. You will be there helping me with this.
I would love to be a support of that.
2018, we will have another walkathon
Wonderful.
for the men. It'd probably be for the whole family.
Yes.
And
yes.
then make sure the men are there as well, because
Absolutely.
they just felt, who do I talk about with this? This is not, we don't call it breast for men. It's gynecomastia for the men. So it's a little bit different for them than it is for us.
Right.
But now, because of so much hormone in the diet and everything,
Exactly.
they have a lot of tissue there.
Right.
So we do need to examine. We do need to check. And that's part of, and actually what I did is just made that part of the initial visit.
Hormone
Even-
testing? Or the
no,
thermography?
The thermography.
Okay.
Hormone testing, is part of my overall lab package. So we do functional blood testing.
Right.
Yeah, and then set up a whole program based on, and then, we do so much of the same thing. We're almost saying the same thing. So amazing.
Well, that's,
And we've never sat down and had a long conversation. I'm catching you when you're working and
Yeah.
I'm running. And
Right.
when I called you yesterday, you said yes. And I just thank you again.
Oh,
from the
no
bottom of my heart.
problem. What a pleasure.
Thank
What a
you.
privilege. I
Thank you.
appreciate the invitation.
Thank you. What are you seeing more in your practice today now that we're so inundated with all these toxins in the food quality and Roundup and stuff? What are you seeing more in your clinic?
I'm seeing a lot of challenges with immune system. My interest has always been the digestive system. So, you can make a connection to the digestive system, immune system.
Yes.
If you're just looking at the physical side of things in so many ways, because they're all connected, right?
Right.
But the immune challenges, I'm seeing hepatitis, I'm seeing HIV come through, cancers, and they're getting younger and younger with the
Yes,
cancer,
they are. Yes,
which is
they
really
are.
sad to see. But part of what we do is give them hope, not just fluff, but okay, let's get objective. Let's find out where you're at right now, numerically speaking, get their history subjectively, and then come up with a treatment plan, go through that, and then retest again, check in again. Oftentimes patients will come through and they'll think, oh, you're not, nothing's helping or whatever, right? But as you know, many of the tools that we use affect so many systems. It's not
Yes.
just one molecule that we're trying to
Exactly.
obliterate or deal with. So you come to find that their energy's better, their sleep's better, their bowel habits are better. Just overall, as a whole human being, they generally move in the right direction.
Yes, they do.
We can't say that we cure anything without wanting to invite legal issues.
Exactly.
But, there have been some remissions of some cancers in my world, and I'm grateful. And of course, it's not necessarily my doing or the patient's doing, but I really believe that God is behind it.
Oh, I know
and
he
we're
is.
just the instruments of his design.
I've seen it so many times.
Sure.
And this is why I had a radio interview years ago, and I had mentioned that this person was healed. Because the person said, oh, my goodness, you're going to get in trouble. But I didn't say I healed the person.
Right.
I said that God healed the person. And this person was a believer, so he knew that he was healed because of, when you go deep inside, because some people have come into the clinic and they're like, oh, you're going to give me this treatment for pain, and, oh, I know one treatment that's not going to do it. I said, why? Where's your faith? What's to say that you cannot have one treatment and it's gone? You might have had the pain and it came in one day. Why is it cannot leave in one day? But we're going to be realistic. But if your mind thought, and that's your belief system, no, you're going to walk out of here with that pain. 99.9% of the people who come to me for pain do not walk out of that door with that same pain. They do not, unless you want it. Some people just want to carry that pain, that condition. There's people who don't want to be healed. I look at a person very closely because of my own history, and I ask them, do you want to live? But now, instead of asking that, another practitioner I met years ago said, ask them, when did you decide you wanted to die?
Ooh, that's powerful.
It is.
Wow.
And you look them right in their eye
Yeah.
when you ask that question. You might not have said it. It could have been a thought. It could not have been a thought that you lingered with. But somewhere in your fiber, you said, this is too much for me. This marriage is too much for me. This job is too much for me. I don't want to be here anymore.
That's it.
And what happens
that's
to
powerful.
the body? What happens to the immune system when you do that?
It's listening.
It's listening. And it's changing.
Yes, it is.
It said,
It
okay,
is.
this is what you want. And then things in your health start to show up.
Right.
And you say, well, and then you have to go back through that journey and start letting go of that stuff. Forgive yourself. Forgive that person so you can
Yes.
go on and proceed with this journey of healing.
Right.
And like I said, I know through this from personal experience from many, many, many years ago, and then start working with other people. And I said, And the next question I asked them, and look very closely in their eyes, is, do you love yourself? Yeah,
I bet a lot of people would have challenges with that.
they do.
Yeah. You know, it's interesting you bring that up because sexual trauma in youth is a common denominator that I see with people that have chronic diseases, that they've been
That's a good
violated
point.
in some form, both men and women. It's becoming more and more common, and it's very, very sad because we're not talking about it. It's not really publicly spoken about, and it perpetuates from generation to generation.
Right. That I have seen as
Yeah.
well, especially when you can get the entire family involved and get a history of what's been going on.
Right.
So, how are you working with patients with epigenetics?
We aren't doing too much in that regard. We have a very good test. I don't know if you're familiar with Boston Heart Laboratories. They're out of Massachusetts, I believe, and all of the testing on their panel relates to how it affects the cardiovascular system.
Okay.
But there's a genetic section in there. They check for 4 major genes related to whether they could tolerate statin drugs or whether they need activated forms of B vitamins. We're not using the testing, although there is testing from a company called SpectraCell.
I'm
Yeah.
familiar with SpectraCell.
Yeah.
Been with them for years.
Yeah, they're great. They're great customer service and lots of good information. I got interested in epigenetics a while back, but I got distracted by stem cells and all the other good things that are out there.
Yes.
So I sort of put that on the back burner. But telomeres are interesting to me for anti-aging.
Telomeres are fine, great. We had Dr. Gordon, and he just did a show on telomeres.
Oh, wonderful.
Yeah, well, he did it this year.
Good information.
Good information. That's telomeres, because I was doing the telomere testing with SpectraCell.
Yeah.
Yeah, SpectraCell does the telomere testing. So that's very important. I have another little device, and we'll talk about some things that I do in testing,
Right.
the biological age versus your
Right.
chronological age. So it's a little tiny device. It only takes a couple of minutes. And, I always feel young. I mean, people say, well, you don't look your age. But when I did my test, I was actually 35 years younger. And
What do you say, chronological versus
biological.
biological? So biologically, you were 35 years younger.
I was 35 years younger.
I love
And
it.
so when I tested someone else, it always say, oh, I'm always in pain. I'm always tired. I'm always this. And then past history of some things in their life. And they were 25 years older.
Oh, yeah.
Yeah.
I could see that. And what's interesting to me is the mind, body, spirit again.
Yes.
Because we don't really know the effect of those areas on this objective finding that you are
Exactly.
presenting.
Yes.
And it would be interesting to do a little study to
We
see.
should, because I said I'm not growing old and I'm not going through menopause. And I am 60 plus and never went through menopause.
Wow.
But I said I was not. That is not my friend.
Right.
I'm not inviting this into my body.
Usually they say it's leaving the body, but you're saying inviting. That's an interesting
years
perspective.
ago, I said I'm not going to.
Okay.
So now, that I'm 60 plus, and we'll have a birthday next month. I mean, month after next.
Okay.
Yeah. So we're going to have a really big celebration on this birthday. So everybody
can't
here,
wait.
including Jarvis, I know will be there. He's wonderful.
It'll be
here.
good. It'll
Yeah.
be good.
But it's just a blessing to have lived this long,
Yeah.
obtained the knowledge. In every aspect of our lives, we learn something, we grow from it. And then when a patient walks in the door and it's like, this is why I ask the questions that I ask. Mainly because that was me years ago.
Really?
Yeah.
I'm not familiar with your story.
No,
I
you're
would-
not. But I had colon cancer. And when did it happen? Way back then. Been in a coma, went to hell.
Wow.
So
Wow.
those things happened.
Right.
And so it made me the person I am. That's why a person walk in the door, I can look and tell where they are. Are you happy with yourself? Do you want to live? What's really going on? What is it you really need to let go? So when you look at me and you say, well, I have this symptom, that symptom, I know it kind of emotionally what it's attached to because of my own journey.
Right.
So the second coma, I went to heaven. So it was wonderful.
Wow.
10
You've been
years
around.
later. I've been
Yes.
around and back again. So the journeys
Wow.
actually have helped me with people, helping
Sure.
people to heal after a divorce. Because that's really rough. And where it's going to hit is that heart. So I watch a person's heart very closely with, the enzyme, the blood tests, the echocardiograms, everything, to make sure that heart is going to be hit. Because what do you say? He broke my heart.
Exactly.
You said it.
Right.
So you got to watch the heart.
Right.
And maybe we need to, bump up the CoQ10 or do some things here. So when things are hitting my heart, like I had a situation in my own family this year that was really devastating. I said, okay, let me just give myself a coenzyme Q10 injection. I need quick relief on this one.
Right.
Yeah. So, and you feel so much better.
Yes.
So things that are happening to us emotionally, and I tell people, if you're diabetic, I have high blood pressure, whatever, we have to watch everything that's going on. My daughter, who has her master's in nutrition, was working with a young lady with diabetes. And she said, well, you're eating the right thing, you're doing this, you're doing that. Start checking your blood sugar at work because that's your stressful zone.
Right.
And that's when it was elevated. It had nothing to do with her diet and exercise, and she had lost the weight. It was the stress.
Likely the cortisol, right?
Yeah. So I tell people, if you're under a lot of stress, you can go to lifeextension.com and you can order the 24-hour cortisol tests. You don't need a doctor's prescription to order these tests through Life Extension. And you need to know these things yourself, empower yourself, because it's so important that you do.
Absolutely.
It's so important.
Absolutely.
So I'm going to come back to you before we conclude the show, but I want to talk to my guest over here. And I just thank you so much.
Well, you're welcome. I'm enjoying the conversation.
I can tell. I can see. I can kind of read you over there.
Yes.
So KB, I again want to thank you for the music that you do, and tell me a little about yourself, because I just read your resume and it's so in depth. So we're gonna be giving out your website so people can really read as to who you are. But tell me a little bit about you.
Well, wow, about me.
Yes, yes.
Well, let's see. Of course, I was born in Baltimore.
Okay.
Brought up in the state of Alabama. My journey. I mean, all of us have our drama in our lives, but for me, I believe as a child, I was always my question is always why and who. I'm a questioner by nature.
Okay.
And so I question everything. Why did I meet you? Why was I born? And I would say to my mom, why are we here? And where do we come from? And she said, God put us here. And I said, well, why? And she say, I said, why is there suffering in the world? Why won't God remove it? I had so many questions.
Yes.
And my greatest question was, as a child, was how did that little leaf find its way through the cement, the sidewalk? And I would sit there with a hammer, trying to get through it with a hammer, admiring the leaf that was so soft that it got its way through. And so my thing about life is, my theme is remembering who we are. And I believe that is the big thing about humans. We've forgotten who we are.
Yes.
And someone said, who are we and what are we? I said, well, I believe it's undefinable, but you can feel what you are through the vibrations of life. And that started happening with me years ago, but it's been an unfolding like a rose. And but my thing is a great music has played a big role in my life.
Yes.
In detoxing. I didn't call it that when I was a youth or young, but that's what was going on.
And the title now is?
The title now is a rather long name, but I give you the initials, MDVST.
Give the name.
Multidimensional Vibrational Sound Therapy.
Yes.
And I call it that because it started in my private time. I was an opera singer for many years, over 25 years. And I would sit with my acoustical guitar and sing to myself and to the universe. And when I did that, anything that was stressing me was gone.
How wonderful.
Magically.
And the vibration of the music.
Yes.
But you have this tone in your voice, too, that's so therapeutic. That you now have used it with, you have to tell that, too, how you've been using it with your clients, but.
Yes. Well, actually, I've been field testing it.
Okay.
And I have taken it into various situations, a lot of them where people tell me it shouldn't work. It's not my style. It's not my genre. I'll share this with you. I've been keeping it on the down low for the most part, but I was trying to figure out how do I field test this.
And do I hire an agent or manager? So what I did was I actually signed up with Uber and Lyft.
Yes.
Right. And I got this nice car with a nice sound system. So I have all my soundtracks in there. So I pick up people in later. I've been doing this for about a year.
Yes.
And I've been just all over the city, in South Central and Beverly Hills and Westwood. So I pick up people, and the first question is, "Oh my God, please tell me you don't Uber with that voice." And they say, "What do you do?" And I said, "Well, actually, I do vibrational sound therapy." And they say, "What is that?" I said, "It's designed to detox you mentally without getting into your personal effects, what happened to you, and but basically let the vibrations work." So I would start, and I said the best way to show you what it is by proof is in the pudding.
Yes.
Give you an example. So
Yes.
they sit in the car and I give them an example. And their expressions usually are, "Wow." Many people cry, men and women, but it's a good cry. You know, we were told after we grow up we can't cry anymore. But as babies, we cry when we get ready. We release. But as we grow up, we hold everything in. We don't
Yes.
release anymore.
Just suppress.
Yes. So my work is designed to get you to release in your own way. I don't tell you where to release or how to. And someone said, a young man, I was in a hotel doing some samples, and a young man was in a distance listening. And he said to me, "What did you do to me?" And he was saying he said it's freaking me out. So music is a great entertainment, but there's a level of music that I believe we've gotten away from. And that music was meant to heal us, to help us on this journey.
Yes. Yes.
And as we all know, this human experience can be very complicated.
Yes.
And there are many components to fixing what's wrong.
Right.
And
we have to wrap it up. I'm going to
Okay.
bring you back again.
Absolutely. Absolutely.
And I'm so happy you were able to come on such a short.
My privilege.
Because people are going to hear, as we close the show, they're going to hear your voice again. This is, people have called me and asked me, "Who is this?" But we're definitely going to be doing this very, very soon.
Yes.
Okay, because I
Yes.
want people to get a sample of this vibrational healing as we are on the show here. And I just want to say that Dr. Lucy Rojoan, I want to thank you again for coming.
My pleasure.
And KB, I thank you for coming. And
My
we're going to get
privilege.
more and more. The time, I can't believe the time just went by so fast.
It did.
It really, really did. But I want to thank you so much for the time,
You're welcome.
your time, and what you're doing, because your bio is so extensive. We're going to definitely have you perform next time you're here.
Excellent.
Okay? So I want everybody to, as I end my show, and to repeat after me. Take a deep breath first. Breathe out. And repeat after me. I am so grateful
so grateful
that I am
that I am
a magnet
a magnet
for miracles.
for miracles.
Everyone have a wonderful, peaceful, and blessed day. Hug somebody, give them a free gift, give them a smile. Have a blessed day.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.